Excellent. My name is Dr. Monae Raphael, and I am very pleased to have been invited to speak to you today at the 5th Global Webinar on Public Health. I will be discussing age at the intersection of income and health, investigating patterns of child health status, female caregiver income and age in a changing economic, social, and policy landscape. I did hear a brief bio that was given about me as I was setting up my slides. So here's just a little bit more. I am an alumna of New York Medical College, Morgan State University, and UMD&J. I've completed bench science research at Hopkins and the NIH. And most salient to this talk today was my time as a policy fellow on Capitol Hill. And that really became the inception point, again, for what I'm going to present to you. Currently, I serve as CEO of my own consulting firm, and most near and dear to my heart, I am a caregiver to a 7-year-old child with autism. So we're going to cover 7 kind of main areas today, beginning with the relevance and background and problem statement. I'll then quickly go over the research questions and hypothesis, methods, results, and then we'll end with the future directions that I think are available for this study. So when we think about age, income, health, and female caregivers, I think it's appropriate in this global public health conference that we actually don't take a US-based starting point, but that we actually apply a global lens. That is because women's health and child health are a global public health priority. Of the 8 billion persons worldwide, 49.5% currently are women. And unfortunately, as this headline does show, there has been a staggering backsliding that has occurred in the areas of women's and child's health. And so why has this occurred? Well, some gains had been made globally. Unfortunately, and as the speaker eloquently was sharing right before my talk, the pandemic has led to a slipping away. The speaker was referencing mental health outcomes. I want to talk about the social safety net, the social and protective measures that have actually slipped. And unfortunately, more women and children are now slipping into poverty. So now that we have kind of that global landscape view, let's zoom in on a US-based policy, and that is Social Security. I would like to position this as a primary income and social support policy. Time does not permit me in this very limited segment today to give a very comprehensive overview of this nearly 100-year-old program, the various amendments to the program to talk about the impending insolvency of the 2 trust funds, and the various proposals to change the policy. Suffice it to say, we're going to hit some very brief talking points today, and I hope you can follow along. As of 2022, there are nearly 66 million beneficiaries. Notice the 3 groups of the beneficiaries that are listed here on the slide. These consist of retired workers and their dependents, survivors of the deceased worker, and then disabled workers along with members of their family. The benefit is very modest. It's estimated next year to be just under $2,000 monthly. If you take nothing away from this talk, I would want you to remember Social Security is an effective anti-poverty program. There is so much literature that backs this. Focus on the box. You will see that Social Security effectively prevents nearly 1 million children and 22 million other adults from slipping into poverty each year. Moreover, I want to focus on the impact of this program for women and minorities. There is an even starker need for a social safety net for women. Notice 9.5 million women are protected and about 3 million minorities. So why is Social Security so critically important to women? Well, women tend to live longer than men, tend to have smaller pensions or savings, And most importantly, women spend time outside of the workforce as caregivers, and that time is unpaid. Why is Social Security a critical lifeline for minorities? Minorities tend to have lower lifetime earnings, and minorities tend to have higher morbidity, which leads to mortality in comparison to white counterparts. Please remember, Social Security also supports the household. It does not just consist of a benefit to the beneficiary. And so survivors of the deceased worker, as well as household members of the disabled worker, also receive support. Let's talk about now social determinants. Now that we have this kind of policy lens, we know that income is a primary social determinant, and we know from the groundbreaking work of Marmot and Wilkinson that there is a gradient, a social gradient of health. What does that mean? Persons with higher social status or income tend to have better health. Conversely, persons with lower income tend to have worse health. And then there's a stepwise gradient incrementally, so that as income increases in a stepwise fashion, so does health. Now that we have kind of all of those pieces together, let's fit this puzzle more precisely. So if we consider the convergence of factors currently that are pushing more women and children into poverty globally, current estimates show that between 60 million to 100 million more children are now at risk of poverty kind of in this COVID pandemic reality versus where they were prior to the pandemic. A lot of research has gone into female caregivers of childbearing age. I would like for us to stretch our focus, now that household demographics have changed, to consider that caregivers are actually aged across the lifespan, and they are caring for dependent children. And so I'm showing you quickly the 4 research questions. I'll focus on the questions. I'll invite you to look at the hypotheses as I read the questions. I was interested in if child health status would differ between various household income strata, if child health status would differ by caregiver age, and I created 2 cohorts of caregivers by age. I was interested in the presence of specific child health chronic conditions and if those would differ by caregiver age. And then most importantly, kind of what happens in terms of female caregivers slipping into poverty if we do make proposed changes to Social Security policy. Very quickly, I'll invite you to look at the variables that I assessed as I just go over the methodology for my work. This was a quantitative method with a descriptive cross-sectional research design, and I examined the research questions and hypotheses just identified using 3 data sets. Primarily the National Survey of Children's Health. This survey has over 90,000 respondents. The US Census data files, that is both the CPS and the ACS, and then the Social Security Administration Master Beneficiary Record. As I said, I created 2 cohorts of female caregivers. So that would be caregivers ages 20 to 54 years, and then females 55 years and older. And then I was looking at the overall health status of their dependent children, a subset of specific chronic conditions. Those are the 14 subvariables there. And then I modeled kind of the percentage of female caregivers that were pushed in or lifted out of poverty based on proposed changes to Social Security policy. Again, time doesn't allow me to kind of go into the details of these changes, but to suffice it to say, on face value, the policies that have been proposed do not very readily show that cuts to benefits would occur. When you think of raising the normal retirement age, when you think of decreasing or increasing the cost of living allowances, these can be difficult to actually understand how much benefit actually leaves the household. And that's the precise type of policy changes that I was looking at assessing. So here are the results. Hypothesis 1, I believe that there would be a difference in the distribution of child health status among various household income strata, and that was correct. As we know, there is a social gradient of health such that in this sample, as income increased, so did excellent, very good, and good health. Also, as income increased, as we would expect, fair and poor health decreased among children. Hypothesis number 2, I actually expected children of younger caregivers to have better health status across each measure. And that's not exactly what I found. So notice this chart is showing in that final column, worse child health status. So here's what I found. While there was worse overall child health status among older caregivers, there was actually higher BMI and more exposure to smoking for children who had younger caregivers. There was no significant difference overall for oral health and chronic conditions comparatively between the caregiver cohorts. And then I found that there was more overall exposure to smoking among younger caregivers versus more exposure to smoking at home among older caregivers. Hypothesis number 3, so this is looking at that subset of 14 subvariables where I was actually examining specific child health chronic conditions, and here's what I found. Essentially, there were some conditions where there was worse overall child health status among older caregivers, but there was no significant difference found across the board as it related to epilepsy, seizure, hearing and vision problems, again, when I was looking at comparisons by caregiver age. And finally, let's think about this kind of poverty slippage and anti-poverty protective effect of Social Security. So if you just focus on the first chart here, hypothesis 4 was looking at, would more female caregivers, that is age 59 years and up, would they be pushed into poverty in retirement if Social Security policy changes were to take effect? And this is, of course, in comparison to the baseline amount in poverty for this sample. So first, we know that dual income households, and certainly households with dual Social Security beneficiaries, they have more earnings. So there is already in place more of an anti-poverty protection. I'm focused, however, on households where there is a single mother or there's an older caregiver with no father present. So one Social Security beneficiary, and you're going to focus right in on that row, single mother, no father present. So what do we know? Well, we know at baseline, in aggregate, so this is all races, we know that more than half of these families are already living in poverty. When you add that Social Security benefit, then we know that poverty protection occurs. So this proportion is almost cut in half. However, if you continue to follow the columns across, if changes to Social Security policy were to occur, then we can see again that the same families that were protected from poverty, they slip right back into poverty. Now let's add on, if we just kind of jump right to it, I did stratify by some other variables, but I want to look at minority head of householders or single mothers where no father is present. And here again, just to get right to the punch, at baseline, 80% of Black head of householders, so female caregivers, were in poverty. When you add the Social Security benefit, the proportion is staggering. This number decreases to almost 20% in poverty. And then when you apply proposed changes to Social Security, 40% slip back into poverty. So again, you can very clearly see the anti-poverty effect or the protective effect of Social Security. So there's not time in this limited segment for me to detail very comprehensively the strengths and weaknesses of this study. There were many. Suffice it to say, this was introductory. I wanted to make a first foray exploration into these factors. I'd like to pivot in the very few minutes that remain just to talk about future directions. And again, on the heels of the previous speaker, we know that an estimated 1.5 million more children globally are parentless as a result of the COVID-19 pandemic. What does that mean? It means that child poverty, child health, are at risk. I love this quote here by Marmo and Wilkinson, and this is challenging us that if we're going to focus on child health, we really need to be looking at the factors that will move the needle. My position is that the factors that should be considered are caregiver age across the lifespan, income, and social safety nets. In conclusion, let's go right back to the beginning. We need to be thinking about caregivers across the lifespan because the landscape of households has changed in the United States and globally. We have multi-generational households. We have skipped generation households where there's a grandparent and no parent present, of course, lost in the pandemic. And so we have this combining and burgeoning of the youngest and oldest under one roof. We also have increased life expectancy here in the US. So if reforms to social safety nets and protections are not responsible, then we will inadvertently affect those that are most reliant. And as I've discussed in this talk, those would be women and children, and then synergistically, minority women and children. So to conclude, I hope to delineate today how the confluence of these factors and these relationships are salient. And it is my sincere hope that this research could be furthered and that we could more seriously consider these factors. Thank you so much.